self-care or a care plan to send the patient home with after they received a treatment for a specific injury, condition, whatever, a treatment segment that you've performed is very, very important. What you do on the table to the patient is very integral to promote healing, but what they do after is equally important, if not more important, than the work that you do. How comfortable are you sending home your patient with care plan or with homework, as we used to call it in massage school? Do you tell them after a massage they need to drink water, they need to ice, they need to elevate, they need to rest? Do you give them stretches that you can't prescribe stretches, but you can suggest that they do them? Another thing too is all part of the education process is that they understand what has happened to their body and how they can prevent it in the future, but also how they can accelerate or promote and continue the healing process that you've started for them. If you have someone who comes in with thoracic outlet syndrome is a very big, bulky word, and it's not something like I have water on the knee, which is very, very descriptive. Thoracic outlet syndrome, unless you know where the thoracic outlet is and you're familiar with what a syndrome is and some of the symptoms and things that happen there, it's not something that is in most people's general knowledge bank. So explaining to someone what thoracic outlet syndrome is, what causes it, and how some of the things that they're doing might be contributing to their pain or their symptomology can be very, very vital to changing a behavior or modifying a behavior in these people. How comfortable are you with explaining these sorts of things and giving them things to do on their own once they've begun treatment? At Integrated Touch Education Services, when you take one of our pathology classes or a syndrome class or a disease-specific or condition-specific class, it comes with, if you approach it from the subjective, objective assessment and plan format, or the SOAP format that is used for documentation in massage generally, as a generalized acceptable method of documentation, if you follow that format, subjective is what the patient tells you is wrong. They give you a list of symptoms or they come in with a prescription. The objective is what you observe through their behavior, through palpation, through working on them. The assessment is how you've changed whatever they came in with, and the plan is what you send them home to do and when you want them to come back. So the P part of the SOAP, or the plan part of the SOAP, would include things like drink water, ice, alternate ice and heat, elevate, rest, stretch, things like that you want them to do on their own is vital for them to continue healing. So how comfortable are you with all of that? Our classes break down all 4 components of treatment, as well as giving you the techniques and helping you with the documentation, helping you make sure that everything is nice and neat and tied up in one little package. Integrated Touch Education Services is here to make you a better treatment therapist, to get your outcomes to be more successful, and we would like to help you get better at conversing with your patient, directing them in what they should do or what they might have been doing that has caused part of the condition. How comfortable are you with all of this? Could you use some help there? Give us a call.